Preventative cardiology is pivotal for all cardiologists to embrace. Most of the cardiac issues that patients develop later in life or even in their midlife can be prevented. My name is Briana Costello, and I'm an interventional and general cardiologist here at the Texas Heart Institute Center for Cardiovascular Care. Prevention for me is identifying high blood pressure before a patient can feel it, because you can't feel blood pressure. And if you start to feel blood pressure, that's really the red flag. It also means lifestyle changes. So counseling patients on what is a healthy lifestyle, what is a healthy, quote, diet, which turns into a lifestyle. And then, of course, being active. Activity is huge, and we know it prevents heart attacks and strokes and death. So just talking to patients about what they can do to get active or what their goals are really encapsulates prevention. So prevention is pivotal every day in a clinic, every conversation that we have with a patient. Early diagnosis is really important in cardiovascular disease, and for us it's very important nowadays that not only we take a good history and a family history, but we can now identify patients with a calcium score, meaning do they have plaque in their arteries already at a young age but otherwise are asymptomatic. They don't have chest pain, they don't have shortness of breath, but perhaps they're in their mid-40s and they already have plaque that's accumulating in their coronary arteries. This calcium score is pivotal in my daily practice nowadays because it can change management long-term for patients. If a calcium score is 0, that's certainly reassuring, but if it's elevated, I can become really intense with the patient and really have a focused care plan for them long-term so that later in life they don't have issues and they don't need any interventions or stents. Heart health for women is super important and close to my heart. No pun intended, because for decades, heart disease in women was ignored or perhaps shadowed by heart disease in men. We know now that women die at the same rate as men from heart disease, and over the last really decade, we've improved some of these outcomes with making people more aware. That includes patients and providers and physicians aware that heart disease is the #1 killer for women. In my practice, I often find women that have had complaints of cardiac issues that were maybe shoved under the rug, but we know that it's important to identify them. If it can happen in a man, it certainly happens in a woman, and we should treat the women just as intensely as we treat men. My philosophy, especially in the clinic, to treating patients is really to form that relationship and that element of trust that we can have together so we can make decisions together. Whether it's a decision on a blood pressure medication or cholesterol medication or an activity or a lifestyle change that we can work together on to change their long-term long-term goals or their long-term cardiac profile, that's really my philosophy, working together.